Joining us this morning, our friends from Titusville Area Hospital. Kelly Clark is with us. Hi, Kelly. How are you?
I'm good. How are you, Luke?
Good. You are the, if you didn't know this, the marketing and communication specialist, Titusville Area Hospital. Did you know that?
Okay. I am. I actually brought a special guest in with me today.
Excellent.
Yes, this is Dr. Catherine Policina. She is our new ENT specialist at Titusville. So thanks for having us on.
Yeah, good morning. Thanks for coming in this morning.
Yeah, thank you for having me.
Well, tell us a little bit about yourself.
Yeah, so I'm Catherine Policina. A little bit about my personal background. I was born and raised in the Philippines. My mom and dad were civil engineers before they shifted into business, in which they did a pretty good job. So shout out to my mom and dad. They raised us 3 girls. So I have an older sister. She helps in the business. And my younger sister is a lawyer in the Philippines.
Wow.
I am married. My husband is also a doctor. He is a urologist. He's practicing in Allegheny Health Network in St. Vincent Hospital in Erie. And we have a lovely daughter. She just turned 2 weeks ago.
Wow.
Yeah. So in terms of my professional background, I finished my Bachelor of Science in Public Health in the University of the Philippines, and then my med school in St. Luke's College of Medicine, then did my residency training in ENT and head and neck surgery, also in the Philippines in Rizal Medical Center. That's a Department of Health Tertiary Government Hospital. And then right after residency, I flew to Florida for my fellowship. I did a rhinology and endoscopic skull-based surgery fellowship at the University of Miami. And now I'm here.
That's great. Well, welcome.
Thank you.
At what age did you know you wanted to be a doctor?
Oh, so for as long as I can remember, I am the only doctor in the family, so there was really no footsteps to follow before me. There was no family member who would tell me, oh, this career is very fulfilling, take this path. But really at a very young age, when people would ask me what I want to be when I grow up, I would always say I want to be a doctor. And we didn't know where it came from. But personally, I believe it was God who planted that desire in my heart at a very young age. So that's going to be my purpose. So I just followed my heart. I followed my calling, and I'm very glad I did, because it's just a great privilege to be able to save lives, help people, alleviate their pain, and in general, just improve the quality of life of people by improving their health.
So on your journey, at what stage did you know, okay, this is the field I wanted to get into, the specialty I wanted to do? Did you have a couple thoughts in mind, or did you think, I want to gravitate towards this?
Yeah, so I've said I didn't have someone who guided me step by step into this. It was 4th year in med school that I learned, there's so many kinds of doctors, and you might want to choose one which you want to do for the rest of your life. And out of all the rotations that I did, it was ENT who really stood up for me for so many reasons. First, I would say that because in ENT, for me, it's like a perfect blend of medicine and surgery. And second, if you fix the problems with your hearing, with your sense of smell, with your taste, with your speech, and how you breathe every day, it's how people connect to the environment and how we appreciate the world. So if we fix those problems, you've had that very significant impact on them. So that's very rewarding for me. So I really fell in love with ENT. And, I still get to choose and treat patients of all ages, both pediatrics and the adults. And also there's just so much variety in ENT. Like in 1 minute, you're doing a consulting clinic. The next minute, you're cleaning ears. The next minute, you're doing nasal endoscopy, laryngoscopy, and you can do a lot of in-office procedures. And then the next day, you're in the OR doing major cases. So I love that variety. There's just no dull day for an ENT.
Yeah, no, that's fantastic. So you kind of started talking about it, but specifically, what are those things that are driving patients to come in and see you? What are some symptoms somebody may experience that maybe they should pick up the phone and schedule an appointment with you?
Yeah, so there are a lot actually. So let's go by ENT. So for the ears, even if you just want your ears cleaned, you can call us, of course. We'll be happy to help you with that.
Is it kind of like a dental thing where like every 6 months you should do it? Like, should you have your ears cleaned every so often, or?
Well, people would have like different experience with that. People would accumulate earwax more frequently than other people. So if you know you're that kind of person, you can come to us regularly for ear cleaning. And then for hearing loss, at least for people 50 and up, at least they get to have the hearing screening every 3 years, because gradual hearing loss can be unnoticed, right? And we know that it's a risk for cognitive decline and dementia. So they have to see us every like 3 years or so for checking of their hearing. And any lumps and bumps in your neck, go to ENT, go to us. And of course, I'm trained in rhinology. So if you are experiencing chronic congestion, nasal obstruction, decrease in smell, like facial pain, which might be because of your chronic sinusitis, you can definitely call us. We can help you with that. Allergic rhinitis is very common as well, and we have a lot of options for you. Or if you think you have allergic rhinitis and you've been on a couple of medications and you're not improving, well, you can call us and I'll have to check on you. Maybe it's not allergic rhinitis at all, and we have other medical options and surgical options for you.
Okay.
So those are the common ones.
It seems like around here, allergies pose problems for folks. I'm somebody who has issues with allergies and like sinus pressure and that kind of thing.
Make an appointment with us.
Well, I'll just come over there and just over and done with. We'll do a live on-air screening or something, allergy testing. Yeah, no, there's no testing. I can tell you, it's no, that's fantastic. Well, what about the people side? I assume you enjoy helping people.
I do, really. Like, when I came to Titusville, I really think this work environment really aligns with my goal to provide high-quality patient care. So, I like caring for people.
Is it one of those things where you like to get to know your patients? It's fun to see them and
interact with them and establish that personal relationship between a doctor and your patient. With the family. We always deal with families, because when we treat kids, you're always with their parents, with their obviously caregivers.
That's great. Kelly, for the hospital, again, recognizing the needs of the community here?
Yes, so we started with Dr. Pineru. She was our first full-time ENT that we hired after Dr. Tay left. And we were so busy that we brought Policina on board as well as a full-time ENT here. And really to top off those services, I just recently had Devin Zarovchak on. She is our audiologist. So she's going to work really closely with our ENT department and offer hearing exams where needed and offer help with existing hearing aids, getting new hearing aids, things like that. And that is a need in the community as well. And it really goes hand in hand with the ENT department that we are really growing and establishing. So we've definitely seen that need in the community, making it easier for patients to get those appointments and be able to come in and see the provider when they need to.
Yeah, that's wonderful. Was it important for you to know that you were stepping into a situation where you had this structure in place, the supporting cast that you can go to just to help you do what you do?
Yeah, it's very important, and I'm very happy and very impressed with how supportive they are, especially our CEO, Lee, and our very hardworking practice manager, Megan Miller. So they really ask us what we need to extend our services and to be able to have a complete set in the clinic so we can help our patients.
Yeah, Kelly, are people surprised at how quickly the hospital responds to suggestions? Because it seems like it's like, oh, here's a need the community is facing, and the hospital is quick to respond to that.
We are, and they seem to be quite a few steps ahead. It's funny, I go to a lot of things in the public and talk to people, and they say, just recently I was at the YMCA, and someone came up to me and said, you know what, you need to add dermatology. And I said, funny story, we are. We're adding it in December. So it really happens like that. And I think it starts with a lot of our doctors. They see what's needed in their patients. They see that maybe we're sending patients to Erie consistently, or to Pittsburgh to see a specialist, or even to Meadville. which isn't that far away. But, if it's something that we can offer close to home, we definitely try to do that. And yes, they have been really good. Titusville is really good at bringing those specialty services close to home. And it's really working out well. And I think the community is very appreciative of that.
That's great. You're watching The Morning Drill on Stream TV and on the Armstrong Neighborhood Channel. Friends from Titusville Area Hospital with us here this morning. You mentioned dermatology. Who were you bringing in?
Yes, so we have a nurse practitioner that she is doing training currently in Meadville. Through the dermatology services offered in Meadville. She's being trained, and in January, she will be starting her own practice here in Titusville. So really exciting to be able to offer that. And just one more thing that we're going to be offering.
Awesome.
Yeah, we're
You've
excited.
got some other things coming up as you round out the year.
Yeah.
Can you believe we're saying that?
Yeah.
Yeah.
Yeah, I can't believe that it's already halfway through October.
Yeah.
It's amazing. So we, like I already talked to you about, we are added audiology with Devin. She is scheduling patients now. We're still working on getting some of the equipment since it is a new service that we kind of had to build an entire new practice for her, and there was a lot of sound booth work and things like that and new equipment that we had to bring in. I do believe you can start getting your appointment established, but we're not in full swing yet for all of the services, and I'll let you know what's to come with that.
Okay.
Brittany Masterson, we are welcoming her. She is new family care in our physician services. Some of you may be familiar with her. She has worked a very long time at the Express Care in Titusville. So she was looking for a change, and she came aboard with us, and we're very happy to have her. I know she has quite a following. A lot of people really know her and enjoyed her care while she was at Express Care.
Excellent.
So she will be part of physician services now too, doing family care. We are also adding Dr. Timothy Scott. He will be coming to Titusville and doing podiatry on a part-time basis. Really great because he will be able to also assist with wound care. Not only podiatry services such as bunions, ingrown toenails, toenail trimmings, any kind of heel pain, things like that, but he will also be taking care of lower extremity wound care. So we're really happy to have him. He will be starting beginning of November, I believe. So get ready, you'll see some ads and things like that and some different services that he'll have available as well.
Excellent.
Yeah.
Auxiliary luncheon.
Yeah, we recently had our October auxiliary luncheon. A new slate of officers was presented and really talked about some things that are up and coming. We will be having our Lights of Love fundraiser. I know, it's hard to talk about all these things that are, just moving forward so quickly.
Just the holidays are coming. That's the thing.
They
right?
are. Ready or not, they're coming. So we'll be having our Lights of Love fundraiser. It's a really great fundraiser for auxiliary. They raised over $5,000 last year. We also are doing the angel ornament tree again. We brought that back last year, and it was a very large success. Thank you to everyone that donated. For those of you that aren't aware of what that is, you can, I believe it is for a $5 donation. You can put a loved one's name on our tree that hangs in the lobby. After the Christmas season, you can take your ornament home with you and put it on your own tree. So it's just something to remember or honor somebody that maybe you would like to honor, or somebody that you had lost recently. So it's just something that the auxiliary used to do in the past and brought it back last year, and it was a resounding success. So we're excited to do it again this year.
Excellent. October is Breast Cancer Awareness Month.
It is.
And
We've been doing a lot of breast cancer awareness because the foundation has a fund It's the Breast Cancer Awareness Fund. A lot of monies are donated to this every year, especially in the month of October. So what that fund supports is free mammograms for anyone that is uninsured.
Wow.
So one way that we are raising funds for that is we have a chair in the lobby. If anyone's noticed, it's bright pink and gorgeous.
Yeah, I don't think you're going to miss it.
Yeah, it's very cute. It's very lovely. We did it last year for the first time. It was a pretty big success. We were excited about it to do it again this year. Tammy Cornell is the donator of the chair. She is a longtime supporter of the Breast Cancer Awareness Fund. So we were excited to have her donate another one this year. We've already sold quite a few tickets. The drawing will be on October 31st. We have some information on our Facebook page. You can also go on, if you don't want to come into the hospital or you live out of town, you can still go online and purchase a ticket.
Excellent. And then there's some career opportunities. You can go to the Facebook page or website to see what's available.
Yes, we're always updating our Facebook page and our website with current opportunities. If you don't have internet access, that's okay. You can always call the HR department. You just call the hospital directly and ask for the HR department. They can get you all the information you need. You can fill out a quick apply form online as well. That's just a really easy way to get your name in there. If you are called in, you can fill out a formal application, but it's just one way to help us get some qualified people in the hospital.
That's awesome. Wonderful. And you have to be excited to get things started and established here.
I'm very excited. Very, very.
Yeah.
So when you come into a situation like this, what are some things that you get to kind of put your stamp on, or do you kind of just see how things play out and then?
Yeah,
okay.
so that's how we are starting right now. I'm shadowing Dr. Renu Pinero, so I can be very familiar with the system. And then hopefully by next week when we're all settled, because we are moving into another hallways because we are expanding our services. So when we are all settled in there, then we can start seeing patients.
Oh, that's exciting.
Very exciting.
That has to be great.
Looking forward into it, yeah.
Now, can folks start calling to schedule appointments, or Kelly, how does that part work?
So they can.
Okay.
If they need to be seen right away, they will be probably scheduled with Dr. Pinero. If they want to be scheduled out, they're just looking to get established, they can be on Dr. Policina's schedule. So
Excellent.
It really depends on the need of where they would like to be in that schedule. But yeah, definitely give the office a call. They will have all the information. The number to call is 814-827-9770.
And maybe just real quick, run down those symptoms that somebody may experience where they probably should say, you know what, I got to make time. Let's schedule an appointment.
Okay, so for the ears, if you have hearing loss, chronic ear infection, like recurrent ear discharge, ear pain. Okay, so those are the symptoms. You go to us, call us. If you're experiencing tinnitus or ringing of the ears, you can also definitely call us. We also get a lot of referrals for vertigo. You just want to make sure if it's coming from the ears. So we have repositioning maneuvers to help you. For the nose, of course, if you have problems with your breathing, could be from deviated septum, and it's causing you a lot of bothersome symptoms during the day. It's interrupting your activities. Definitely call us. If you have chronic rhinosinusitis, bothersome allergic rhinitis symptoms, call us. Any lumps and bumps in your neck that needs to be further worked up, you should call us. Any foreign body sensation or lump in your throat, those are the symptoms that you should be able to be checked with us.
Okay, that's great. You mentioned family.
Yeah.
What do you do at the end of the day to unwind and relax?
Oh, yeah, great question. Really, my main, most effective stress reliever, I would say, is my husband and my daughter. Yeah, we play at the end of the day. Yeah.
Oh, so I cause stress to my wife, but that's good.
Yeah, so, at the end of the day, when I see them healthy and happy, my battery pack is like fully recharged again. And spending quality time with my family. And we love to travel, so we drive to the close by cities. And it's great that in this country you have a lot of national parks. So we've been checking the list one by one.
That's
So,
great.
yeah.
Well, welcome. Congratulations.
Thank you. Thank you so much. And thank you for having me here.
Oh, all the best to you. Kelly, good to see you this morning.
It's very good to see you. Thanks for having us on, Luke.
Yeah, and if folks have any questions about what's going on at the hospital,
Yes, they can. So we update our Facebook page all the time. We like to really put a lot of information out there for anyone that's looking for specific services. You can go on to our website, which is titusvillehospital.org. You can also go on to our Facebook page that I said and check that out. There's lots of different links that link directly to our website to learn more, and you can call the hospital.
good to see you. Thank you.
Good to see you.
All right, take care.
Thank you.